Dr. Anshuman Agarwal is a senior consultant urologist and robotic surgeon in Indraprastha Apollo Hospital in Sarita Vihar, New Delhi. Dr. Anshuman is having a rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient health is in a safe hand. Over to you, Dr. Anshuman.
Hello, good evening.
Yeah. Dr. Anshuman, I would start with the questionnaire. What is prostate cancer?
So, prostate, as we all know, is a gland only found in males, and it is situated in the urinary tract. If you would just permit me to show you the anatomy. So, this is the male urinary tract, as we are all aware, and this is from where this is the urinary bladder, wherein the urine gets stored, and the prostate is right at the mouth of the urinary bladder. So, this is the prostate here, which I am pointing out with my pen, and the urine flows from the bladder through the prostate, because the tube, which is the urethra, which is carrying the urine out from the bladder to the exterior, it passes through the prostate. So the prostate is located here. So normally, in men beyond the age of 50 years, it begins to enlarge and starts creating an obstruction to the flow of urine. So this the tube that is passing through the prostate gets obstructed because the prostate is enlarging, and it causes compression on this tube. Now, there are two ways by which this prostate could enlarge. So, one is a regular, which we term as a benign prostatic enlargement, and the second one is what is called as a cancerous prostate. So, the prostate could enlarge out of two reasons. Benign is more common and is age-related, and cancerous is the second most common.
So, are men more likely to diagnosed with prostate cancer?
So, prostate cancer will only be diagnosed in men. The men who are at special risk are the ones who have had a first degree relative in the family with prostate cancer. Suppose there's a man whose father had a prostate cancer, or whose elder brother has had a prostate cancer, or whose uncle, the first degree uncle, has had a prostate cancer. So these are the men who are more susceptible, who have a genetic abnormality, in their prostates. So as I said, cancer is some abnormal growth of cell. It can happen with any organ inside the human body. But with prostate cancer, this happens. I mean, there is no specific reason why this would happen, but men with a family history of prostate cancer are more commonly to get it.
So, what are the symptoms of prostate cancer?
So the symptoms of prostate cancer cannot be distinguished from the symptoms of a regular prostate enlargement leading to symptoms. The symptoms essentially could be, taking time to pass urine, taking time to start, some burning, some difficulty in passing urine, poor flow, not being able to pass urine at all, which means there's a complete obstruction to the flow of urine, some blood in urine. And in advanced cases of prostate cancer, there could be some symptoms which are related to the metastatic disease, which means that the prostate cancer has spread to other parts of the body. Now, the prostate cancer usually spreads to the bones. So, and that too, it spreads to the pelvic and the backbone. So, some patients present to us, with history of low backache, and some back pain, some shooting pain in their legs, some hip pain. So they have difficulty in walking. Late cases may present with pathological fractures of the spine or the hip or the long bones of the body. So essentially, the symptoms of prostate cancer are not distinguishable from those of the benign prostatic enlargement. In addition, advanced prostate cancer, usually which leads to bony metastasis, can present due to signs of these bony metastasis, and predominant of them is bone pains.
And how is prostate cancer diagnosed?
So the prostate cancer is diagnosed by very easy means. We have a blood test available, which is called as a prostatic specific antigen. So this blood test can be done on any male, beyond the age of 50 years. One must ensure that he does not suffer from a urinary tract infection, because urinary tract infections lead to falsely elevated PSA, and many a times we see that patients having urinary tract infections, they undergo a PSA examination and the values come abnormally high, and there is a huge amount of panic in the entire family that the PSA has come very high. Now this PSA settles down with antibiotic treatment very soon. So PSA is one test which can help us in diagnosing prostate cancer. It is a very simple blood test. It can be done in a few hours' time. And usually it is correct to the tune of 60%. So not all patients with high PSA will have prostate cancer, and not all patients with the normal PSA will not have prostate cancer. So you see that the accuracy of the test is somewhere to the tune of 60 to 70%. So about 30% of patients with high PSA will not have prostate. 30% of patients with a normal PSA can still have prostate cancer. So to offset that, we have another thing which is called as a digital rectal examination, wherein the urologist he does a physical examination of the patient, and this is done by putting a gloved finger into the one's rectum and examining the prostate. So some patients will have an apparent cancer on examination. Some people will have a normal looking prostate or a normal feeling prostate with a high PSA, which could be prostate cancer. And another mode of diagnosing prostate cancer is MRI, which is a magnetic resonance imaging of the prostate. And PSA, digital rectal examination, MRI are the cornerstone in diagnosing prostate cancer. But the final diagnosis is confirmed by the biopsy. So if there is an abnormality in all of these three, then we go ahead and do a biopsy, and we finally confirm that the patient is suffering from a prostate cancer.
And how is prostate cancer treated?
Prostate cancer treatment is highly dependent upon what stage we find it in. So if I were to tell a layman, the prostate cancer could be of three types. One is an organ-confined prostate cancer, which I showed in the initial part of the conversation, the prostate gland. So if the prostate cancer is confined to the prostate, then the treatment option will be different. If the prostate cancer extends beyond the prostate, but it is in the local vicinity, then the treatment option will be different. And if the prostate cancer is metastatic, which means it has left the realms of the prostate and has gone to other parts of the body, then the treatment is different. So for localized prostate cancer, we essentially have two options for treatment. One of them is a robotic radical prostatectomy, and the second one is radiation. So radiation and surgery are the two main options of treatment of localized prostate cancer, which means an organ confined or a stage 1-2 prostate cancer. Now, for a locally advanced prostate cancer, which is a stage 3 prostate cancer, which means that it is spread slightly in the surrounding tissues, surgery is not a very good option because you are likely to leave behind cancer cells, and then the treatment will be left incomplete. Hence, radiation forms the cornerstone of treatment in such group of patients where the prostate cancer is locally advanced, right? So after that, this radiation treatment is combined with hormonal treatment as well. Now, for metastatic prostate cancer, the treatment is essentially hormones. Now, there are first level of hormones, there are second level of hormone treatment, and so on and so forth. And there are several advancements in terms of medical, but it is essentially medical treatment. And then there could be certain palliative treatments wherein, we know that we cannot treat this individual for sure. So we do certain treatments to make him comfortable, to make his life comfortable, which could aim at relieving outlet obstruction, when the prostate enlarges and is cancerous. So there is a blockage of urine. So we could do a procedure to open the urinary passages. Then there could be bleeding. So we could do a procedure to alleviate the bleeding. We could give him palliative radiation for his bone pains, some chemotherapy, some hormonal therapy, and certain, therapy aimed at strengthening the bones. So there are several forms of prostate cancer treatments, depend on what stage the patient and what physical fitness and what is it that you are looking to treat. So depending on all these factors, you tailor-made a treatment for a given individual.
And what kind of follow-up treatments are available right now for this treatment?
So whatever is available right now is pretty much standard, and all treatment options that could be available anywhere in the world are available with us in India. And the follow-up of prostate cancer again depends on what stage of prostate cancer you are treating. Essentially, mostly we monitor the patients by doing a routine PSA investigation, and post-treatment the PSA levels should be as close to zero as possible.
Can a man survive a prostate cancer?
Yes, absolutely. A patient with an organ-confined prostate cancer who undergoes treatment at the right point in time can have a fairly normal life as any other individual.
Well, Dr. Anshuman, it was a very informative session. Thank you for your valuable time. Thank you.
Thank you. It's been my